Hello, my name is Jeremy Alman. This is Nicole Brooker. This is Luke Lang, and we're all student physical therapist assistants. We're going to be presenting today about how to manage a shoulder pathology, both within the clinic and what we're going to be sending home with the patient, from the acute phase to the subacute and into the chronic phase. So a little bit of history on our patient. Patient is a 30-year-old female who's been working in a warehouse, has recently picked up to 14-hour day shifts, and has been experiencing some shoulder problems from that. The pain is occurring when she's reaching overhead, working in a warehouse, lifting heavy boxes, and it's pretty bad. It's an 8 out of 10 pain with function, 5 out of 10 when she's just inactive. The pain is kind of an anterior lateral pain in her left shoulder, and she is currently off of work, and it's limiting her ADLs as well. Patient does have a history of motor vehicle accident about 10 years ago, as well as a latex allergy. So we're going to be keeping both of those in mind through our progression here. So at the initial workup from the PT, the patient showed limited flexion, external rotation, and abduction. All of them were limited by pain, both in active range of motion and passive range of motion. From that, the PT instructed the patient to be icing, to limit how much she's using her shoulder, the Codman's exercise, using a foam roller on the shoulder, as well as some scapular retraction, just to kind of get started and working within that pain-free range. So we're seeing the scenario here is we're seeing the patient again with the next session still in the acute phase. Pain is still high. It's going to be a limiting factor. So we're going to be working mainly to both get started on some exercises, reduce the pain, and hopefully getting a little bit more movement and strengthening in it. So to start out, we're going to be doing a manual therapy session for both massage and using some grade 1 joint mobilizations. We'll be doing those for about 15 minutes to try and reduce the pain and also loosen up the patient so that we can work on some other things as well and get out of that pain area. And then also to start out with, before we instruct on any kind of proper lifting technique, we decided to start with ADIM and working on breathing technique. Nicole's going to demonstrate how we would teach that to a patient.
All right. So we're going to be working on engaging core and in breathing properly. This is important whenever we're doing any exercise. You want to have a good, strong core because it's going to help protect your back. It's actually going to make the exercises easier to do. So it's something that we want to learn how to do now, get that down pat, and then when we're doing all the exercises, you want to continue to keep this in mind. Okay. So just to kind of practice doing it, I'm going to have you lie down on your back. First, we're going to work on finding a neutral pelvis. So to do that, you can kind of have your hands on the side of your hips here. You're going to roll it forward and back until you can find a comfortable position, and that's going to be your neutral. Okay. So that's where we're going to want to stay for all the exercises. While you're in that position, we're also going to want to engage the core. So you're basically going to be pulling your belly button in towards your body, so the muscles kind of in this area become tight. And I'm just going to do a check by your pelvis and make sure that we're getting that down. It looks like you have that down pat. Do you feel comfortable doing that? Yes. Also, one more thing to keep in mind, we want to make sure we're breathing throughout the exercises. As you're doing the hard part, the exertion, you exhale, and as you're coming back down, you're going to be inhaling. Okay. Does that sound okay?
Sounds good.
All right.
Great, thanks, Nicole. The next thing we decided to work on is some isometric strengthening for the posture control with an exercise called YTWA. Instructing the patient to perform that twice daily, holding the positions for 5 seconds apiece for 5 sets. Nicole, do you want to show us how to teach that as well?
All right, so we're going to be doing a little bit of a strengthening exercise here just so we can get started on strengthening. So later on we can hopefully kind of move into something a little more advanced. But just to get us started, again, what we just talked about, we're going to keep that in mind, engaging the core and breathing. Okay. We're going to start up in a Y position. Now you want to come up until, you don't want to feel any sharp stabbing, shooting pain, but just kind of as far as you can comfortably. We're going to be holding that for 5 seconds. Okay. Once we're done with that, we're going to move to a T, so that's just kind of coming more straight across. And that's going to be held for 5 seconds as well, keeping all those same things in mind. Then we're going to move to more of a W position, so your arms are coming in at your sides. That will be held for 5 seconds, and then we're going to go to an A, so your arms are down below here, and holding that for 5 seconds.
Okay. We decided this was a great exercise just because with movement is when the pain is most frequently occurring, so we're trying to reduce movement, but we also have to get that strengthening, including that core stabilization, getting some extra scapular strengthening as well. Working in that posture so we can eventually progress forward into some other strengthening for that. With that exercise, we can do that both in standing, we can do it sitting, we can progress it onto a stability ball, and we do it in prone as well. At the end of the session, then we applied kinesio tape to the back to kind of pull that shoulder posteriorly so we can get rid of that impingement and try and work on that better posture so she can get some movement going again. And then we finished up the session today with an ice pack for 15 minutes as well. So just kind of giving we gave the patient a home exercise program, included with VHIs in their packet. So we had that YTWA with that same thing that we did in the clinic. We're still using that Codman's to get a little bit of stretching, a little bit of joint mobilization from that. Getting the stretching, anterior chest stretching from laying on a foam roller, and then continuing the ICE program as she has stated that has been helpful for her. This is just a soap note summarizing that's included in your packet as well to read through what we did through the session.
Okay, and I will be talking about the subacute phase here. Before progressing this patient to the subacute phase, we had tested her range of motion and strength, and both of those had increased, so we thought she was ready to move on to the subacute phase. As well as the patient had reported that her pain has been decreased as well. So to continue here, we want to start with that continuing the ADIM and posture and breathing throughout all these exercises that we perform. Again, we're going to do some joint mobilization. This time we move from a grade 1 up to a grade 2 joint mobilization, just to kind of help keep increasing that range of motion. What we're going to begin with now, that we're going to start instructing the patient on, is self-stretching. The patient reported that she had some tightness in her upper trapezius, her scalenes, and her levator scapulae. So Jeremy will instruct the patient on these stretches.
Hey Nicole, so we're going to be doing 3 different stretches today. Okay. They're all going to be involving bending your head to the right to stretch out that left side.
Okay.
So I want you to hold on to the table there with your left hand, and then I want you to reach across.
Okay.
And pull straight over. You should feel that stretch right on the side of your neck and your shoulder. Then we're going to change that just a little bit, and I want you to look down and in and pull across again. Yep, exactly. Right in this direction here. And then the last one, we're going to be looking away, turning in, and pulling down again. And, yep, so then hold those for 30 seconds. And you do those 3 times each. If you feel a sharp pain, then you definitely want to stop. Okay? Great. Thanks.
After the stretching exercises, we are going to instruct the patient on some strengthening now. So we're moving from an isometric to now a more dynamic strengthening exercises. So to begin with, we're just going to work on the shoulder flexion. We have a yellow TheraBand here that Jeremy will instruct the patient on using. This is a latex-free band because of the patient's allergy. Next we'll move into some shoulder abduction and external rotation, followed with bicep curls, and then also some seated row for scapular strength. So again, here Jeremy will instruct the patient on these 5 exercises.
All right, Nicole, so we're using a band today to try and get some strengthening going. So the first one, if you want to stand up next to me, we're going to just put this under your left foot, and you're going to be bringing your arm straight up.
Okay.
Okay? Let's try that one to start out.
All right, sure.
Okay. Yep, keep it straight and straight out. Okay, and then while you're there, just go out to the side as well.
Okay.
So come straight up. Yep, exactly. And this, I want you to keep within that pain-free range.
Okay.
Okay. It's going to feel a little bit tiring, but we don't want that sharp pain from the shoulder. Okay.
All right.
The next one we're going to work on, you're going to have to lay on your stomach.
Okay.
Take a band. And this, just want you're going to let your left arm hang off the edge.
Okay.
And you're going to be rotating up for that external rotation.
Okay.
Okay. So let the arm dangle, and then bring the back of that hand up. Yep. Exactly. Exactly. That looks good. Okay, then if you can sit up, we're going to go into a long sit. Yep, exactly. We're going to wrap this around the back of your feet here. hold on to both ends.
Okay.
I'm gonna be working on a row, so I want to make sure that you're pulling straight back and really getting those, yep, exactly, bring your shoulder blade together here. So the whole time with all these exercises, want that good breathing technique, keeping that tummy tight, and that good EDAN that we learned before.
Okay.
Okay? And then the last one, we're gonna stand up again. Now, put the band underneath your left foot, and we're just gonna keep, hold on, and then we're gonna do a bicep curl.
Okay.
Okay, so just keep your elbow at your side and come straight up. Yep. That's perfect. And all of those, we're gonna be doing 10 reps for 3 sets.
Okay.
Okay? Thanks.
Very good. And with the strengthening, we can obviously progress those. If the patient is able to do, 12 to 14 reps, so a couple beyond what our target is, with very little effort, then we will progress around to a heavier weight or even an unstable surface. So next, we also wanted to challenge the patient's balance. So to start with, we're going to work on a little bit of rhythmic stabilization. With balance, we always want to start with a wide base of support. As they're progressing along, you can move into a narrow base of support, or even tandem, or you can move on to an unstable surface. And then the next thing we're going to work on is also reaching overhead. What we want to do here is challenge their balance. So we actually want to get them to almost the end range before they lose balance. And again, with these exercises, Jeremy will demonstrate with the patient here.
Okay, Nicole, so we're gonna work on a little bit of balance. So we're gonna start out with standing, and you're gonna get just a nice wide base of support. So we're gonna have you hold on to this. And we're just going to be kind of giving a little bit of motion here.
Okay.
And I want you to keep that tight stomach, okay? And I'm just gonna give you a little bit of a challenge, pushing in different directions, okay? And hold in that position. Yep, good, good. Hold there, good. All right. Another thing we're gonna work on is reaching out to my hands.
Okay.
Okay, so this is gonna be helping with kind of trying to reach up, like and putting those boxes away.
Right.
Okay, so same thing, keeping that stomach tight, keep that good posture. I want you to start reaching out, okay? Good, good. Yep. Switch arms for me. Looks good. There we go. Looks good.
All right.
Good. And here you see on the screen is the subacute home exercise program that we had written up for the patient. Again, it's basically the same stretches and strengthening exercises that we just performed and demonstrated for you. So she will do that several times a day with the stretching and strengthening. The important point to note is that we need to stop. The patient needs to stop if there's ever any sharp shooting pain or that pain does return. And the soap note that you guys have in your packet here is just runs through everything that we had just talked about.
Alright, so I'm going to be discussing the last section. Now we're at the point of return to function. Now basically the pain has been addressed, she's building up strength. So now we're looking to work on her endurance. We want to get her back to work, and that involves a lot of repetitive activity. So we're working on focusing on that. So to start, we're going to continue with the stretches that she did the last time, just kind of still working on that tightness, preventing any further issues with that. As I previously mentioned, for strengthening, we're really working on endurance now. So we're doing a lot of the same things we did before, but now the exercises are till she fatigues or loses good form. So to look at functional work activities, the first exercise that we're going to be doing is grabbing a box overhead and placing it back down and coming back up, which is what she's doing at work. So initially she'll be doing that without any weight in the box, just to work on good posture, make sure the form is good there, and then eventually adding some weight and doing that till fatigue. And then she's going to be doing the rowing with the elastic band as she did before, this time on a stability ball. So kind of challenging balance a little more, really engaging that core and looking at good posture with that. So now Luke is going to be demonstrating both of those.
All right, the first exercise we're going to work with is this empty box here. As we progress forward, we can add some weight into that to challenge you a little bit more. But what we're going to be doing is just reaching overhead, kind of pretending like we're setting it on a shelf, like at your house. And then taking it back down, and we'll kind of set it on a table there.
Okay.
So we're going to do that until you start losing form or until you start getting just too fatigued.
Okay.
So what I want you to do to remember is as you're lifting it up here, I don't want you to bend forward with your back, okay? If you need to reach forward, take a step forward and lift with keeping your back straight there, okay?
Okay.
And we're just gonna do that over and over, that motion, until you start losing your form, okay?
Okay.
Yep, excellent. Remember to keep that stomach in nice and tight there. Good, that looks great. I can take the box there for you.
Okay.
What we're gonna do now is that same rowing exercise that you did earlier.
Okay.
And I'll have you sit on this ball here. Excellent. So we're gonna do that same rowing that you did earlier. I'll have you grab the handles here.
Okay.
Okay? And again, this exercise we're gonna do until you start fatiguing, or really just start losing your form there.
Okay.
So, good. And this at home you can stick in a door jamb or tie it to a door handle or your table or anything at home. So
Okay.
that looks very good.
So moving on, some more strengthening exercises. We're going to be doing D2 flexions. So with that, we're going to accomplish flexion, abduction, and external rotations, which are areas that she was having issues with earlier. So now we're kind of combining those motions and kind of looking at making it really functional. We're going to also be doing the same external rotation free weight exercise she's doing before. Again, now focusing on endurance with that exercise. We're also going to be doing the full can arm elevation in the plane of scaption. So we're kind of getting a little bit of flexion and a little bit of abduction, which I said before is two areas that she was limited in earlier. Finally, there's going to be some bicep curls. Same thing, we're working on endurance this time. So Luke is going to be going over those exercises.
Okay. The next exercise we're going to do is I'm going to have you step on the yellow band here with your right foot. Okay? And what we're going to do is kind of start on your right hip with your hand, and we're going to cross over our body, kind of rotating our arm in, okay? Or out, I should say, okay? So we're just going to do that motion just like that.
Okay.
Just go into, if you're having any pain, make sure to stop with that.
Okay.
That looks good?
Sounds good.
Thank you. The next thing we're going to do, we'll put the band down here. We're going to take this 2-pound weight here, and what we're going to do is kind of go at like a 45-degree angle away from your body. So not straight out, and not straight to the side, and we're just going to do this with your thumbs up in the air. Okay? So that motion.
Okay.
Good. And then also, in this phase, we'd also do what we did before, laying on your stomach, rotating that arm out, and then also we would do some bicep curls until fatigue.
Sounds good.
For balance exercise, we're going to be doing basically the same thing that we were doing before with the rhythmic stabilization with the lawn bar. This time we're kind of really moving to fast renovations, challenging her even more. That could be progressed further to closing the eyes as well. As far as a plyometric exercise, we're going to be using the rebounder here. She's going to be doing some throwing, kind of catching in a throwing position and doing that quickly to work on that kind of quick grab and release. And we'll be demonstrating that.
Okay? Same as we did before, I'm going to have you hold on to that bar there,
Okay.
and I'm going to start giving you some pressure here. And I'm going to go faster and faster and faster. Just hold that position there for me,
Okay.
okay? So we'll just start. There we go. Good. I'm going to keep getting faster and faster here.
Okay.
Excellent. Good?
Sounds good.
The next one we're going to do, we're going to play a little ball here. This is going to help with kind of the control on your shoulder and also the strength here and the stability. So what we're going to do is just stand, keep your feet nice and wide apart, and we're just going to throw the ball into the rebounder here. Okay? We're just catching it with one hand, repetitively, as fast as you can go here, under control.
Okay.
That looks good.
Okay.
Very good. Great.
Alright, thanks. So one thing I should mention with the rebounder is we did establish prior to this that she had really good hand-eye coordination. She did really well catching the ball, so we knew that wasn't going to be an issue with that. Alright, so for our home exercise program, she's going to be doing the same box exercise we did before, using her own shelf at her home. Be doing the same stability rolling exercise. She had a ball and the TheraBand for that, and then also D2 flexion. And here's the soap note for that section. And that's the end. Thanks.
Thank you.